Matthew Perry's cause of death was just released, and they are calling it, quote, the acute effects of ketamine. This is a drug that's been used to treat treatment-resistant depression. I was part of a clinical trial that utilized ketamine, or its mirror compound, intranasal esketamine for Janssen. This product is now on the market. I was part of the clinical trials back when it was still in those stages. So I happen to know a few things about this. Let me show you what I found kind of buried. They buried the lead, as it were. Above me, the official findings, but down here below, the exact method of intake is not known. It can be delivered from IV or intranasally. Intranasally prevents you from getting too much. It does come with the side effect of raising blood pressure. Contributing factors in the actor's death, including drowning, coronary artery disease, and the effects of buprenorphine used to treat opioid use disorder. His death has been ruled an accident. Now, there are an interesting number of symbolic and numerical things going on here. The drowning thing is very common in these circles. That is, in my opinion, for entertainment purposes only, not by accident. We have Matthew Perry, who dated Julia Roberts and died on Julia Roberts' birthday. We have Matthew Perry being a part of Julia Roberts' new movie. That's all the news here on TikTok. Everybody's breaking it down. It's interesting how these people sometimes make more money for the franchise after their death. Crazy. I'm sure stuff like that totally doesn't happen, though. You know what I mean? That would be like crazy conspiracy theory bullshit. So, yeah. I mean, is this suspicious? As I mentioned, have experiences with this medicine in a clinical trial, totally legal, above board, and it was not a feeling that I enjoyed enough that I would ever want more of, and I had a really bad experience towards the very end of my participation in the study, and I found the clinical trial doctor to be very dishonest, and it was a very discouraging experience. I learned a lot about the white coats and the inner workings of how these drugs get approved. So I got questions. I got more questions than I got answers, and I think blaming it on ketamine is at best laziness and at worst a bold-faced lie. So yeah, what do you think?